Myself, V. Sirisha from Government College Autonomous Rajamahendravaram, Department of BSc Biotechnology, second year, fourth semester. Today I wanna give seminar from immunology. Topic was antigen and antigenicity. Introduction. Antigen. Antigen is a substance which binds specifically with the products, antibodies, T cells of the immune system. Its ability to bind with antibodies is called antigenicity. Immunogen. It is a substance which produces an immune response as well as binds to its products. So, immunogen is an antigen as well, but antigen need not be immunogen. The property of producing an immune response is called immunogenicity. Hapten. A group of substances usually very small in size which do not produce an immune response by themselves alone, but when combined with a carrier, then hapten carrier complex includes an immune response. Most of the drug producing allergic reactions are haptens. Immunogen and immunogenicity. Development of an immune response in the host by an immunogen depends on many factors. 1. Properties of an immunogen. Properties of the host. Route and dosage of administration of an immunogen. Adjuvants. Properties of an immunogen. Foreign. Immunogen must be recognized as foreign, not self by the host. More distant taxonomically, the immunogen equals to more better it is an immunogen. For example, bovine serum albumin. It's more immunogenic to chick than a goat. B. Chemical nature. Proteins and polysaccharides are more immunogenic. Lipids and nucleic acids are less immunogenic. It enters the hapten. Molecular size of immunogen. Immunogen should have a molecular weight of at least 10,000 daltons and generate an immune response. 5,000 to 10,000 daltons is a poor immunogen. 1,50,000 daltons is the best immunogen. Greater molecular weight is more potential molecule has immunogen. Insulin molecular weight is 5,700 daltons. It was an poor immunogen. Glucagon molecular weight is 4,600 daltons. It is also an poor immunogen. D. Molecular heterogeneity and structural complexity. Simple homopolymer lack immunogenicity regardless of their size. For this reason, synthetic polymer Teflon is used to make artificial implants like heart valves. Homopolymers of single amino acids or sugars lack immunogenicity. Polymer of two or more amino acids is immunogenic. Additional of aromatic amino acid is increases immunogenicity. Properties of the host is in children they have a poor immune system. Young and teenagers have a strong immune system. Oldest people have an poor immune system. Nutrition. Malnutrition causes to poor immune system. Genetic makeup. MHC genes, BCR genes and TCR genes. MHC genes. The function of MHC is to bind peptide fragments derived from pathogens and display them on the cell surface for recognition by the appropriate the T cells. BCR. The B cell receptor. BCR belongs to a family of modular multi-chain activating receptors that are found on immune cells. TCR. In immunology, T cell receptor is a protein complex that helps T cell identify and bind to foreign substances. TCRs are found on the surface of T cells, a type of immune cell. Dosage of an immunogen. Too low dosage fails to elicit immune response. Optimal dosage produces immune response to purify pneumococcal capsular polysaccharides in the antibodies. Too large dosage immunological tolerance is not purified pneumococcal capsular in polysaccharides. Repeated immunogen exposure and booster doses. Single dose, no acquired immune responses. Repeated dose like day 1, in a month, in 3 months. They react in clonal proliferation of B and T cells. Route of administration intramuscular. Inject the injection at 90 degrees angle to the muzzle. Subcutaneous. Inject the injection at 45 degrees of angle to the subcutaneous tissue. Intravenous. Inject the injection at 25 angle. Inject in the vein or dermis. Intradermal. Inject the injection at 10 to 15 degrees angle. Inject at the epidermis. Adjuvants. These are the substances used to potentiate the action of an immunogen, mixed and injected with antigen to boost the immune response. Example albumin, aluminum potassium sulfate, and Frantz adjuvant. Action of adjuvants by prolonging antigen exposure, by activating the phagocytes, by activating the helper T cells, by granuloma formation. Thank you for watching this video.